Member Schwarzy, Member Selman, Member Tornatori, Member Zay.
We have a quorum. So we move on to item number 3, public comment. And we do have public comment this morning. Welcome, everyone. I'd like to call to the podium Mr. Frank Merritt, if you'd like to come forward, please. We do allow 3 minutes for each speaker.
Thank you. Over the past several years, I've been a precinct committee man and have also served as a poll watcher for several elections and as an election judge during the last municipal election. At the board meeting in September, I spoke about how well our elections have been handled in the recent past and about the importance of new voting equipment. A large number of other people spoke about that as well. This was and is a major concern. At that meeting, I thought it became clear that the new equipment was essential, that the recommended HART system provided the tracking, verification, and security that are required, and that it was the best available choice. I believe the discussions and subsequent RFPs that you've sent out and have now received have verified that. From the agenda for today's meeting, it appears to me that the HART InterCivic system is the only one that has survived your investigations. So I hope and expect that there will be a unanimous vote in favor of that today. If that is the case, then I only want to thank you for taking care of that. It's important that this be approved and that the order be placed. Thank you.
Thank you very much. Next up, we have Mary Hoby.
Good morning. I'm Mary Holbein from the League of Women Voters of Downers Grove, Woodridge, and Lisle. And on behalf of our members, I am really hoping that we can move forward today for a vote in favor of the recommended election equipment so that we can get this done and get it started today. We really need new election equipment. There's no question about it. The committee has recommended yet again the same company, which appears to be the best quality of the ones that have been looked at with the different RFPs. So please move this forward and let's get going on it. Thank you.
Morning, everyone. I'm here, my name is Karen Daly, and I'm here on behalf of the co-presidents Sarah Allen and Michelle Parcell of the League of Women Voters. So I'm going to present a statement from them. So thank you. The DuPage County Board is urged to approve the purchase of voting equipment as recommended by the county clerk. The results of the second round of voting equipment bids may or may not have been what the objectors of the first recommendation by the county clerk were looking for, but a decision must be made promptly. The due diligence by DuPage County Election Division staff performed in preparation of the advertisement for bids and the review of the bids from the start should give the county board confidence in moving forward with the approval of the recommended voting equipment. Time is now of the essence in order to protect our future elections. It is imperative that the new voting equipment that meets operational requirements for a secure election is purchased in a time frame that allows for delivery and proper training of election staff and election judges before our next election. And I'm an election judge, so I echo that. The 600,000 registered DuPage County voters and taxpayers must have confidence in secure, operational, and safe election equipment for the upcoming June 2022 primary election, as well as future elections in years to come. Thank you for your support and acting in the best interests of DuPage County residents by accepting the recommendation of the DuPage County Election Division. One other comment on a separate item, an important issue of redistricting. We'd like to thank you for the transparency provided to the public, including opportunities for public engagement throughout the redistricting process. And we support the county board on approving the proposed district maps. Thank you.
Great, thank you. And I am advised we do have online public comment. Thank you. Go ahead, Dana, please.
First comment from Margaret Brownlee regarding voting equipment vote. Dear board members, a wonderful recommendation has been made today regarding purchasing our DuPage County voting machine. We are now moving forward into the future and securing more free and fair elections. Verity delivers unmatched efficiency in the polling place. Automated ballot management ensures a fast and accurate check-in for voters. Transparency is the cornerstone of all HART products. Verity tabulates votes from human readable information, not a black box barcode or QR code, ensuring 100% voter verifiability. The above descriptions of Hart are two reasons today to support the careful vetted Hart Verity vendor today. Make us proud and happy constituents and say, yes, I will make sure my precinct knows you did the right thing. Thank you. End of that comment. Next comment, Erica Nelson. Subject, Agenda Finance Item 9I, recommendation for approval of purchase of voting equipment. Good morning. Thank you for the opportunity to provide comment to your committee. I am unable to attend in person due to work. The following comments have also been sent to be read into the record at the county board meeting at 10 a.m. Last month, the county board took action on the election division's selection to replace the county's outdated voting equipment, and with a majority vote, declined to support that recommendation. For the past month, the professional staff members of the election division, working in partnership with the professional staff members of the county procurement's office, finance department, and state's attorney's office, present a recommendation that meets the criteria that will deliver to the more than 600,000 registered DuPage County voters and taxpayers safe and secure election equipment for upcoming June 2022 elections and those that follow. This recommendation meets the expectations set by this board and is an example of the collaborative work of excellent public employees, as Chairman Cronin has acknowledged. Your process was followed and 2 bids were vetted, and there is a reduction in the final contract amount in this recommendation. As an election judge and advocate for a strong and secure election process, thank you in advance for voting yes to this recommendation. The professional staff members of the election division, from those who answer residents' calls to those who lead the department, must begin immediately to prepare for the June 2022 elections. Your eye will make that happen today. Thank you for your service and support of what is the best for the residents of DuPage County. Sincerely, Erica Nelson. That concludes that comment. Next comment from Donna Prepajal, subject election equipment. Please vote in favor of the following agenda item for the County Finance Committee meeting for Tuesday, 10/26. B, Finance-Chaplain. Number 1, FIP 0401-21, recommendation for the approval of a contract to Hart InterCivic for the purchase of voting equipment system and services license maintenance for the DuPage County Clerk Election Division for the period of October 26, 2021 through November 30th, 2025, for a contract total amount of $7,264,965.60 per RFP 21-086-CC. Most of DuPage County election equipment was acquired in 2001 and is no longer supported by the manufacturer. The DuPage County Clerk partnered with the DuPage County Procurement Services Division and a team of subject experts to devote 3 months evaluating the election systems available to them. The system they chose will offer 100% paper ballots, 100% auditable, no remote access software, external cards or drives cannot be inserted, and made in the USA. We need to support the county clerk's choice. Senior citizens take their responsibility to vote seriously. We need ballots that are consistent and easy to read. End of that comment. Next comment, Jill Lexier, subject, recommendation for the approval of contract to Hart InterCivic for the purchase of voting equipment system and service license maintenance. As an experienced DuPage election judge and the Illinois State Policy Advocate for National Council of Jewish Women, I'm committed to safe, secure, and accessible elections for DuPage County. I strongly support the purchase of Hart Verity voting system as recommended by the DuPage County Clerk. The clerk's office partnered with the DuPage County Procurement Services Division and a team of subject matter experts, spending months in a transparent and inclusive evaluation process of suitable election systems. The Hart system is clearly the best choice as it offers not only great value, but also 100% paper ballots, 100% auditable, no remote access software, external cards or drives cannot be inserted, made in the USA, uniform ballots for vote by mail, early voting, and election day voting. Why purchase now? Most of the election equipment was acquired in 2001 and is no longer supported by the manufacturer. The clerk's office needs to order equipment soon so that it will be received in time to train the thousands of election judges like myself needed to efficiently and securely hold an election in 2022. Don't delay. Please vote for safe and secure elections for DuPage County by approving the purchase of the Hart Verity system. End of that comment. Next comment, Neil Samuels, subject Hart voting systems. I'm sincerely looking forward to modern functional election equipment for DuPage County. As an election judge, I strongly support the Hart voting system. End of comment. Those are the end of public comments. Done.
Hey, thank you so much. Thanks, Dana. Excuse me. With that, we move on to Chairwoman's remarks. So the state's attorney's office was asked to provide guidance as to the requirements for remote attendance and the process a chair must follow once a member seeks to attend a meeting remotely. Last week, everyone should have received an email titled Advice of Counsel OMA and Remote Attendance Guidance. For clarification purposes, it is important to note that in the past, the governor's executive orders overrode the OMA. Currently, that is not the case. On or after July 25th, 2021, the OMA requires in-person attendance at public meetings by members of an Illinois public body and limits when remote participation by such members is permitted. It's imperative to go over the state's attorney's opinion so everyone has a clear understanding of the OMA requirements. The OMA does provide for remote attendance. If a quorum of the members of the public body is physically present as required by Section 201. A majority of the public body may allow a member of that body to attend a meeting by other means if the member is prevented from physically attending the meeting because of 1, a personal illness or disability, 2, employment purposes or business of the public body, and 3, a family or other emergency. Pursuant to the DuPage County Board rules, a member seeking to attend remotely must provide 24-hour notice to either the county clerk or the designated committee secretary to the extent possible. The request must be approved by the majority of the board of the committee. Additionally, if a request is due to a family or other emergency, the member should consider if the member is prevented from physically attending the meeting by a sudden or serious event or unforeseen change in circumstances that called for immediate action. I know myself and other members have expressed serious concerns with members driving while attending meetings. Our county board rules section regarding DuPage County board members participating by electronic means has been updated and will be up for your consideration by the end of the year. The rules will now include an additional paragraph that prohibits members from operating motor vehicles, watercraft, aircraft, or heavy equipment while attending a meeting by electronic means. Members in violation of this rule shall not be considered to be acting upon county business by participating in a meeting electronically and may be subject to censure. This addition is necessary because if a member is involved in an accident while phoning in, the county will be held liable, and the individual board members who voted in favor of permitting attendance could be held individually liable if they knew or had reason to know the member was operating a motor vehicle at the time of calling in. I would recommend that all board members familiarize themselves with the board rules and the Open Meetings Act. I would also like to thank the state's attorney's office for their clarification and guidance on this most important issue. Also, on our agenda today, you will see item 7A. It is the budget transfers. Due to a printing glitch, the paper copies of the finance agenda show 7A displayed twice. The item only appears once incorrectly on the electronic agenda posted online. We're not sure why this happened on the printed copies, but we need to only vote once, and we'll look into the printing error. And then finally, Please remember that at 2 p.m., we will have a special call Finance Committee meeting to discuss the ARPA allocations. And recognizing the extended day of meetings, our executive staff, Nick, Cheryl, and Joan, bought lunch for the county board members to be served in the caucus room beginning at 12:30. So lunch will be at 12:30, legislative will be at 1, and then we'll have our special call Finance Committee meeting at 2. And with that, we move on to our presentations, and we welcome our DuPage County Health Department. Karen Ayala is coming up. Thanks, Karen.
Thank you so much, Chairwoman Chaplin and members of the Finance Committee, for the opportunity to talk with you about our budget. While I was here, I thought I would also provide you with a quick update on where we're at with COVID. So we'll start with that first. I'd also like to acknowledge members of my leadership team who have joined me both here in the room today as well as on the live stream. So thank you for all your support, Team DCHD. We see from this map and from news reports that we continue to have over 90% of US counties at the highest level of community transmission, meaning they have over 100 new cases per 100,000 residents in the past 7 days. You will see, however, some lifting of the red. You know, last time I was here, I think the entire country was red. So we see some elements of hope. The two colors that are most significant for those of you who are looking forward to masks being not mandated anymore are the yellow and blue. So once we get to yellow, then CDC talks about being able to look at mask mandates and potentially lift those mandates. When we look at our numbers, locally, we'll see that the 0 to 19-year-olds, which are represented in red on this graph, are actually the drivers of most of our cases, newly identified cases. However, we are seeing increases in all of the categories and pretty much up to the 70s, 70 and 80-year-olds. Those seem to be holding pretty steady. As we look at the number of individuals per age group who have been hospitalized since the beginning of this pandemic, I think it's really important to remember that these aren't just numbers. We've had over 300 children hospitalized. These are friends, family members, coworkers, and again, children. We've seen a tremendous toll on our residents, and we want to really work hard to continue to prevent these severe outcomes. Now, most recently in our hospitals, we see that the numbers have come down somewhat since the beginning of September, the end of August. However, if you remember back in June, we had a total of 10 people in the hospital from COVID. And so we have brought the numbers down. They're certainly nothing like they were last winter, but they remain persistently and stubbornly high. On the right-hand side of the slide, you'll see that the hospital availability for ICU beds continues to increase over the 20%, which is very, very good, as well as the number of patients being admitted on a 7-day rolling average being on a decreasing trend. When we spoke with our hospital partners last week, they indicated that they have not, and you'll see this in the blue bar on this slide as well, they don't have a significant number of ICU beds taken by COVID patients. However, they have a significant number of ICU beds taken by individuals who are very, very ill. And so we need to make sure that we keep the number of COVID patients low so that they can attend to the very acute needs of our residents, regardless of what the reason is that they're in the ICU. When we plot this out since the start of the pandemic, you'll see again that yes, we are on a decline, but again, we continue to be pretty high, and that's extraordinarily frustrating for a couple of reasons. When we look at deaths, the most tragic outcome of this pandemic, you see on this graph that in June and July, we had a couple weeks that we had no COVID deaths. Again, remarkable and achievable. Now again, however, we're seeing this persistent numbers of daily deaths occurring. And although the age and underlying health conditions continue to be a concern and a critical factor in these deaths, we're seeing the average age in our deaths trend younger than it was at the beginning of the pandemic. We're also seeing an increase of information coming to us instead of just in kind of real time. We're getting I feel like a better perspective from some of the research that's being done. And in this article, we bring two of the indicators that I've talked about together. So COVID-associated orphanhood and caregiver deaths in the US. Again, what we see is children, yes, are less impacted by severe outcomes from COVID. However, we have had a significant number, and the estimate is from April 1st to June 30th, over 140,000 children have lost their primary caregiver and or a close member of or their parents as a result of COVID. Again, not surprisingly, since deaths have occurred more frequently in ethnic and racial minorities, we see the impact similar in this study as well. Now, the primary purpose that public health exists, if you strip away everything, the very primary purpose of public health is to reduce morbidity, preventable morbidity, which is illness, and mortality, which is death. We see in this graph and in this study that was published in September, we see the critical role that safe and effective vaccines are making across the US. The next chart shows the impact locally. Now, on the left-hand side, or in the blue graphic, you see that we're actually experiencing an increase in the number of cases within our fully vaccinated population. That was at 1 or 2% over the summer. We're seeing an increase in that, which is consistent with the recommendations for boosters. That's why we're so excited and encouraging of our boosters. But in the green and the red slide, and I think this is the overarching message, you see that both in hospitalized cases and cases that result in death, over 99% of the individuals in both of those categories are from individuals who are not fully vaccinated. This is a vaccine preventable illness, and we can reduce morbidity and deaths amongst our residents through the use of vaccine. So how are we doing with our vaccine metrics? You recall that we have been doing very well. However, we're not seeing the jumps of percentages that we had early when so many people were looking to be vaccinated. See that of our total population, and again, admittedly, a percentage of that total population isn't even eligible yet for vaccine, right? But of our total population, we have 77% who have received at least one vaccine and 62% who are fully vaccinated. Of the eligible population, so individuals who are 12 years old and over, 90% have at least one dose and 72% are fully vaccinated. And in the population that was most acutely and severely impacted by COVID, our senior residents, we see that nearly 100% of them have received at least one dose, and 86% have received and are fully vaccinated. We have been focusing over the last several months on the 12 to 17-year-olds. And at this point, they are one of our lowest populations with vaccines. So 67% of 12 to 17-year-olds have at least one dose, and 62% are fully vaccinated. We continue to work with our schools, with our families, and trying to get easy access to the vaccines for those individuals. Now, speaking of easy and convenient access, we have, I believe, achieved our goal that I remember talking to you about early on and it seemed ridiculous at the time, right? When the vaccine supply was so very limited, we talked about our goal was to create a system within DuPage County that getting a COVID vaccine would be just like getting a flu vaccine. And at the moment, you know, at that time, it just kind of blew our minds because we couldn't imagine because of the scarcity of the vaccine. However, we see that now. And again, I think this is one of the really great outcomes with this pandemic has been the development of the vaccine and the distribution of the vaccine across sectors. So any and all of these pharmacies are providing the vaccine and the booster vaccine at this point. When we look at pediatric vaccine planning, which we've been doing for the past several months, we see that today is kind of a red letter day, right? The FDA Vaccines and Related Biological Products Advisory Committee, or VRBAC, that group is meeting. And their recommendation will go to the full FDA. Once that happens, next week, the CDC Advisory Committee on Immunization Practices will meet. We anticipate that if it receives full FDA approval, that will be something that will happen. And then very soon after that, CDC will come out with a recommendation to approve the vaccine for the 5 to 11-year-olds. At this point, it is only Pfizer. And many of the providers in our county will immediately begin providing that vaccine. Within about a week after that announcement, the DuPage County Health Department will be able to provide pediatric doses. Yesterday, we were pleased to learn of the state's robust vaccine plans for children and adolescents. Again, we have been making plans for the past several months, including partnering with the Illinois chapter of the American Academy of Pediatrics and the Illinois Academy of Family Physicians to send joint communication over the summer to all pediatricians and family practice docs, encouraging them to enroll and become providers of the vaccine. We are looking to shift our focus fairly dramatically from adults to children to ensure that all kids across the county have access. We will offer pediatric COVID vaccine clinics at our public health centers in Wheaton, Lombard, and Westmont. We anticipate that we'll begin on the week of November 15th, if all of the approvals are put in place. And then we anticipate discontinuing our use of the fairgrounds clinic the following week. Now, more details will be coming forward and we'll be sure to share those with you, but I wanted to give you a rough outline because this is happening in real time and fairly quickly. We agree that probably a mass clinic setting in a gymnasium is probably not the best if you're looking to pull 3,000 young children together with families and strollers and things like that. So we are also working with our schools and making sure that they have partners to provide school-based vaccination clinics. So we're in that process as well. Finally, as we work toward the end of this pandemic response, and I do feel like we are almost there, and begin to look at lessons learned over the past 20 months, I wanted to share with you that the DuPage County Health Department was identified by the Johns Hopkins University research team as one of 67 counties across the US who performed better than expected based on their analysis of New York Times data with our initial COVID-19 response. The researchers identified that DuPage County, which represents the largest county in the cohort that was identified, was able to bring the curve of cases down more quickly than expected based on the performance of other counties when adjusting for relevant variables. This research finding resulted in an interview with Dr. Beth Resnick, Assistant Dean of Public Health Practice, on this project from JHU and leaders from the DuPage County Health Department to discuss strategies that were employed in DuPage County that were different and effective in those early days of the pandemic. This research will then be used to help inform public health leaders and communities to better prepare and respond for the next public health emergency pandemic. Questions on any of that? Yes.
Member Wachowski, go ahead.
Do we have other public health centers? I thought there's one in Addison, isn't there, on Lake Street?
There is the clinic area, that we share the clinic area with Access Community Healthcare Network at that site. And so we're working with them to see if they can provide real-time COVID shots. We also have, and I failed to mention this, still our care van that's going out on a daily basis. We'll be able to target those communities as well.
Because I would hope all of our facilities that we have any access to provides this in a reasonably short period of time, so the entire DuPage County gets.
Absolutely, absolutely. We share that goal. Yes.
Thank you.
Well, thank you again, Karen, for all your hard work. I just wanted to note that the sheet that you gave us was only for the hospitalizations is only through October 14th, when the hospitalizations were at 4.6 on a rolling average, and now it's down to 1. So that's even better than what your chart shows. I had a question about transmissions versus positivity rate. When we were talking about the governor's different phases of moving back and forth between what eventually got to be no masks, it seemed to be that the standard was 8%. Am I wrong about that?
So the level of community transmission is determined by CDC, and it's based on 2 primary criteria. One is the positivity rate, of which we are very, very low. However, one of the reasons why we're low is that so many more people are testing because they're mandated to test. So but regardless, we'll take it, we'll celebrate it. We're close to 2%. However, the other criteria that the CDC uses to determine community transmission is the number of cases per 100,000, and we are still well above the 100 mark. I think we're about 135 per 100,000 cases, and they indicate that whichever is higher is where you go. So we are still in that high category.
Why is 100 out of 100,000 a magic number? 1 out of 1,000 people. It seems like it's awful. It's an awful high bar to be able to get over.
Well, it is a high bar. However, we were very, very low in June and July. And Chris, I don't know if you remember what our transmission rate was at that point.
Yeah, I'm just saying it's just 1 out of 1,000 people seems to be awful tough to hit. And you've got the entire country in the high transmission, or almost the entire country in high transmission. Like I've said before, there's only 4 standards here, and it's awful tough to hit. But I was also wondering, Illinois is one of only 5 states in the country that still got mask mandates indoors.
That I'm not aware of. The one thing with 1 in 1,000 cases identified on a daily basis to remember is that, especially with the Delta variant, we're talking about an R0 of 6 or 7. So for each case that's identified, we anticipate that 6 or 7 additional cases will be identified per each of those cases, which is why lower is much, much better. And we know we can get there.
Well, thank you for all your hard work, and I'm glad that the federal government recognized how well you've done.
Thank you.
Thank you. We have member Schwerzy, member Zay, and then member LaPlante.
And thank you very much for the nice presentation, Karen. The number of seniors over 65 who have been vaccinated is 99.9%, and that's absolutely amazing and wonderful. Should there be a concern that only 86% receive both doses of that vaccine? That's some 30 or almost 30,000 people that haven't received that. Is that just a timing thing, or have we lost contact with them, or?
Yeah, it could be any number of reasons, but yeah, we would like to see that 86 certainly get higher to the 99. But again, every day somebody enters that 65 and older category and somebody exits. So
do we have any, I mean, you only have limited manpower, but do we have any follow-up procedures for this sort of thing?
So we are working with healthcare systems and pharmacies, and we've had our booster clinic, and we don't have a tracking for individuals yet who have only the 1 dose though. Okay.
Okay.
Yeah.
Well, thank you.
Okay, member Zay.
Thank you, Karen. The one thing I was concerned about, you said that one of the areas where we see the rise is 0 to 19. Wouldn't that make sense, since majority of schools, middle schools and high schools, are testing in DuPage County?
Absolutely.
More than any other age group. So I mean,
well, it makes sense. Yeah, it makes sense from the testing perspective. It also makes sense from the risk perspective, right? So you get that many people inside. We know that is going to happen. And so that in and of itself is not a concern. I think it's an expectation. And it's one of the reasons why we're very excited to be able to offer more kids the vaccine to reduce that spread. But I can tell you our schools are doing a lot of work to make sure that when kids do test positive, that the close contacts are identified, the parents are identified, and the testing does occur. So Absolutely, we have many more people testing. We had all-time record testing numbers between the last time I presented and now. So
it's a good thing we don't see hospitalizations going up in that.
Absolutely, absolutely, and that's the impact of vaccines.
Thank you.
Member LaPlante, and then member Krajewski, and I think we're going to wrap this up because we have a lot of business to get
I still have budget.
to your budget, right? Yes,
Yeah.
and she still has her budget too. So go ahead, member LaPlante, and then member Krajewski.
Thank you so much. Thank you, Karen, for this report. And thank you very much to you and your whole department for this wonderful work that you've been doing. I have to say, I am not surprised in the least, because we've all been watching how hard and effectively you guys have been working since the very start. So, but wonderful recognition from Johns Hopkins, and congratulations.
Thanks.
I'm also thrilled about the availability, soon impending availability for the vaccines for the younger kids. That will be game-changing, I believe. The one thing I would like to bring up is, in these charts and in all of this data, we're talking about hospitalizations and morbidity, but there's another really huge component here for COVID that I would love to hear your thoughts on, which is long haul COVID. So in other words, the reason to get vaccinated, it's to avoid other health complications and long-term complications from COVID that are not always showing up in data such as this in terms of hospitalizations and death, because you can still have that, as you know,
right,
with a mild case. Can you please speak to that and correlate the importance of the vaccinations to prevent those issues as
Sure,
well?
sure. And I don't have data specific on long haulers, but we know that the vaccine reduces the cases of long hauling, if in fact it is a breakthrough case. It does have a positive impact on that. And the best way, because we don't know who's going to be severely impacted by COVID and who's not, the best way to reduce your chances of getting long haul COVID or requiring hospitalization is to not get COVID in the first place. And the best chance for making that happen is to get vaccinated.
Thank you, Karen. Member Krajewski?
Yeah, just the last thing, you start out the slide with that, first thing on our map here about most of the country's high red. Like Texas, Louisiana, Florida, they're all the ones that have all the yellows with the lowest cases, but yet they don't have the mask policies. And
But you were, yeah, exactly. Good point. Good point. And they have lower vaccine rates, right? So what we're conjecturing, theorizing is that the wave of COVID that washed across them over these last couple of months has resulted in most people, remember, we think immunity is highly, the natural occurring immunity is highly protective for about 90 days. That's what's having an impact.
Don't they say the antibodies are better than the shot itself?
No, but antibodies, natural occurring antibodies can provide a level of protection that vaccines can bolster. And what we're seeing there is that since people just got sick with COVID, their chances of getting re-sick, reinfected are less right now.
Can you get us like, I remember Echo said there's only 5 states. I was in Michigan 2 weeks ago and I walked in and there was no mask policy here, which shocked me in Michigan, but
Right.
it sounds like most states don't have it, but I'm just wondering what's the difference between an Illinois and a Michigan, or why some states think it's okay when some don't.
I think the mask policy is something that typically falls on the governors to provide that kind of direction. However, what I will say is Illinois ranks 12th in the country with the level of transmission right now. So we are in that top third of doing well. Most other states that don't have a mask mandatory policy have mask recommended policies, and people seem to go make their choices individually.
Thank you for the presentation.
Okay, Karen, and you can continue on with your budget presentation.
Okay, thank you.
Thank you.
Okay, so it is with that same level of commitment to our vision and the principle of excellence that I'm pleased to provide you a very quick, and I'll talk even faster, of the county fiscal year 22 budget recently approved by the Board of Health. First, some unique context to the budget proposal. Unlike other government sectors, public health never recovered from cuts made in the wake of the Great Recession. State spending and key public health activities between 08 and 18 find that per capita spending was flat or decreased. The only category that saw a modest increase was injury prevention, and that was most likely around heroin and opioid response, which is absolutely appropriate. However, over that same period, researchers found that rates of preventable deaths rose and lifespan decreased, concluding that, in fact, funding is not being calibrated to need. The public health workforce was already strained and stressed when COVID hit. Public health workforce differs from overall state and local government workforce, and you see that on the left side of this graph, when H1N1 hit, we had almost 50,000 additional employees in our public health workforce than we did with COVID. Finally, the threat of the pandemic was always a when and not an if. The consequences of being unprepared for it, lost lives, homes, businesses, careers, educations, and more, really should resolve any doubts about the need to invest heavily in public health infrastructure. We've lost 3 years of life expectancy in some communities over the course of the pandemic, which is remarkable. A year of life expectancy overall because of COVID. That's not going to just come back and adjust on its own. We've been preparing for a war for a long time, but we were preparing for other nations and not viruses, despite the warnings, despite the data, and despite the examples and all the warnings we had. So using that as context, we look back over the past 15 years and characterized this next phase of public health within DuPage County as public health recovery and reinvesting in our future. We calculated our budget based on these revenue and expenditure predictions. These are very similar and should reflect the ways that the county prepared their budget, I would imagine. We have a property tax levy to be increased only for new construction. Our levy is flat at 18.65, and we included about 125,000 additional dollars for that new construction. We have a CPI escalator for our environmental health fees that's estimated, we estimated in the budget to be about 5%. We also expect that there will be increases in patient care billing based on current trends and based on our success in our billing efforts and bringing that expertise. On the expenditure side, we once again included a 3% pool for merit-based increases for our employees, and then calculated other expenditures based upon the estimates provided to us by the county. So overall, you will see that our budget, excluding COVID operations and grant applications, has risen by about 4%. The vast majority of that expenditure is around personnel. To put that in context, however, pulled this slide out. There are high points for all of our staffing, whether that be full-time, part-time, and FTEs, was in 2007. Budget highlights in 2007 included that full-time positions had been reduced. Even in 2007, as a high point on this graph, full-time positions were reduced by 27 from 2006. So it was a significant decrease from 2006. Our low point of all three, full-time, part-time, and FTEs, was 2018. Again, another real no surprise, as 2019 represented the first year the budget included the newly transitioned psychological services from DuPage County Human Services Department to the Health Department. So what comes next with this budget proposal? Well, we know that we need to continue our efforts around COVID. We know that really nothing has gotten better in the world of behavioral health since we have pivoted our attention toward COVID. The demand for psychological services is increasing. There's been an increase in symptoms reported for depression and anxiety, an increase in suicide, an increase in opioid overdoses. And now we're hearing at our Hope Task Force last week that, opioids are kind of stabilizing, and we have methamphetamines and other substances to be concerned about. So we need to get back to those efforts. We also know that health disparity issues were magnified and exacerbated during the pandemic. So access to care, chronic disease, affordable housing, obesity, food security, as well as the increased need for core services, such as our oral health programs, our mental health programs, and our maternal child health programs. And with that.
Member Ozog.
First of all, thank you, Karen, for yours and your department's hard work. 20 months, unbelievable. Thank you.
Thank you.
I do have a quick question though about, you are expecting a 4% increase in your health insurance. And I believe we were told that the county's budget might be up 1 or 1.3%. I recall correctly. And is there some issue there, something, a factor that you might speak to, or?
I think it was an estimate that we had at the time that we were building the budget. So I don't think that. Right.
Okay, so it's an estimated, okay.
Yes.
All right,
yes.
thank you.
Any other questions? Member DeCiani?
Karen, just checking on the reimbursement rates from the state. Are we getting better reimbursement rates as they promised? And are those dollars coming?
We we saw a significant increase in our crisis grant for crisis mental health services. And on an ongoing basis with Medicaid managed care companies, we're also seeing some increases in the reimbursement rates. So yes.
Thank you. If anyone else has any other questions, maybe if you can email them to Karen, because I'd really like to get moving on the
Can I
agenda.
add what, just
Yeah,
one quick
sure,
thing, and
please,
I
please, go ahead.
apologize.
No,
I
no,
just
that's okay.
wanted to make you aware, this is not, and one of the reasons I didn't include it, but we also received a notification in August that we were selected as one of the top workplaces by the Chicago Tribune. And so I'm offering that. It's supposed to be a secret. So the party and parades later, just kidding on the parade. But on November 4th, the Chicago Tribune's 12th annual Top Workplaces program will be held virtually. We certainly have very much appreciated the support of the county board. We recognize that our own board, led by the very talented and capable Sam Tornatore and Paula Deacon Garcia, help provide the oversight, but this has been extraordinary couple of years. And so we wanted just to extend that invite for any of you who are interested. Also, please just drop me an email. And with that, thank you.
Great. Thank you so much, Karen. Thanks for all your work, everything all you and your employees do. We really
Thank
appreciate it.
you.
Thanks for the great presentation. Okay, so with that, we move on to removal of the minutes. Can I have a motion on the minutes of the October 12th Finance Committee meeting? We have a motion by member Chowski, a second by member Desart. Any discussion? All in favor? Opposed? Okay, the motion carries. We move on to item 7, budget transfers. Can I have a motion on FIR 04821? Budget transfers 102621 from various companies' accounting units. We have a motion by member Pachowski and a second by member Garcia. Any discussion? Okay, seeing none. All those in favor? Opposed? Okay, the motion carries. We move on to consent items. Can I have a motion on consent items A, B, C, and D, change orders? They are all change orders to close and decrease. We have a motion by member Chowski, a second by member Rutledge. Any discussion? Okay, seeing none. All those in favor? Opposed? Okay, the motion carries. We move on to procurement requisitions. Member Chavez.
Thank you, Madam Chair. I move approval of EDR 047321 resolution for service agreement between DuPage County and Choose DuPage for the period of December 1st, 2021 through November 30th, 2023.
We have a motion by member Chavez, second by member Covert. Any discussion? Seeing none, all those in favor? Opposed? Okay, the motion carries. Member Chavez.
Thank you, Madam Chair. I move approval of EDP 039421 awarding resolution issued to DuPage County Regional Office of Education for the youth training program, contract amount total of $50,000.
Okay, we have a motion by member Chavez, a second by member Covert. Any discussion? All those in favor?
Aye.
Opposed? Okay, the motion carries. Member Chavez.
Thank you, Madam Chair. I move approval of EDCO 050721, amendment to contract issued to World Relief DuPage and Aurora for the youth training services to extend and increase this contract to $275,621.
We have a motion by member Chavez, a second by member Desart. Discussion? Seeing none, all those in favor?
Aye.
Opposed? Okay, the motion carries. We move on to finance. Member Kuczynski.
Thank you, Madam Chair, and move on FIP 0401-21, recommendation for approval of a contract to Hart Intercivic for the purchase of voting equipment system and service license maintenance for the DuPage County Clerk Election Division.
We have a motion by member Krajewski, second by member to start, and discussion. I see member Zay, member Wachowski, member Krajewski, member DeCiani.
Thank you, Madam Chair. I just want to, I know a lot has been said and we've gotten a lot of emails that at no time, I think anybody, we've kind of made this into a Democrat Republican thing. At no time, I think any of my colleagues didn't want new election equipment. I think there was issues with that first RFP. We got two different bid sheets, an 80 point, 100 point. There was some confusion. And I have no doubt if we had awarded Hart back at that time, this contract back then, we would have been sued. I know many of us tried to work to somehow amend that first RFP. And finally, with the help of the state's attorney's office, it was said, no, we have to go back out. I didn't care if it was election company ABC Elections or whoever it was, just want to make sure the process was right. I think it was done right this time. The selection's been made. I think this contract gives us a lot more flexibility and we need new election equipment. We all know that. I want to thank our staff, the state's attorney's office, the clerk's office for working through this and getting this forward. It's important that we get new equipment. But again, just the process last time just had too many questions. And I think we erred on the side of safety by going out and doing this and coming back with the contract we have today. Thank you.
Thank you, member Zay. Member Wachowski.
Thank you, Madam Chair. I support this as well because I think one, it's 4 years. And I do have some questions though, because on the decisional memo and as well as the Section 6 purchase requisition information, there was nothing for fiscal year 2022. It goes 2021, 2021, and then FY 2023. If 2022 is an election, why is not money being incurred in 2022 fiscal year?
Adam Johnson.
So I believe Jeff just said that was due to maintenance. If you have questions specifically about the fiscal year budgeting, finance might be better able to address those.
Because it's both on Section 4 and Section 6. You think in 2022, when we have an election on brand new equipment, that they would be kind of hands-on for that 2022 period, yet there's no payment for fiscal year 2022 in this.
So the purchase is in 2021, it's for the equipment and 1 year of maintenance, which is essentially 2022. We're fronting that. So you won't have any expenditure for maintenance coming out of the clerk's budget for 22. We're just fronting that now.
So that's the second, that's the 335,000, even though it's being paid in 2021, it's gonna be incurred in 2022.
Right.
Because I just want to make sure that we're incurring no expense in fiscal year 2022, because that's what this contract shows, correct?
For maintenance and the purchase of the machines, you will have expenses for things like paper, printing, stuff like that.
My other question is, as I kind of going along with Mr. Zay, I realized that we needed election equipment. And I think the process last time, and I talked to both you and the state's attorney, Bob Reynolds, and it just seems to me this thing was really convoluted, it was confusing. I didn't know really what was, it wasn't an apple to an apple, it was an apple to an orange. I didn't know that $10.6 million Hart contract was a 1 year contract. Is that correct?
The last one?
Yes.
Yes, 1 year renewable.
So I fully support this position. I think 4 years is very good. I'm concerned about the fiscal year 2022. My only question is, when we have 80-pound paper, is that something that we put in? Because that's like $1 million. It seems that's a lot for paper for a 4 year period of time. And Pete's in the printing business. Why does it have to be 80 pound and not something less that's much cheaper, which would still be just as good?
So the paper specifications are based on our staff's recommendation in terms of the paper stock that is needed for ballot printing. So our staff, there's the flimsier the paper, obviously there's some issues in terms of putting ballots in the mail for vote by mail and those ballots being damaged and running through the machines. So that was the paper stock that our staff felt best served ballot printing.
And my last comment is, I think we're saving $300,000 by what we're getting last time and this time, which is good. I'm just kind of disappointed that we didn't have more people bidding on this contract. And my understanding is Dominion didn't even respond to emails as far as pricing or anything like that. So I don't know what the issue was, but it seems to me this is a very huge contract. We should have had more. I'm hoping we get better informed on this in the future. Thank you very much.
Thank you, Member Kachowski. Member Krajewski.
Thank you, Madam Chair. I'll say Poland one there, Sam, but no. You're surrounded and we're going to annex you. So thank you, Madam Chair. I think I started this thing when I was looking at the pricing score and not being in the first initial thing that we had in front of us, and then asked for some information, and as it was coming in slow, I spent an awful lot of time on this issue. I've learned an awful lot. But I did, as we moved to the last part of this last meeting, after we had a 3-week delay, I had asked for Appendix A, and I had a lot of concerns about the RFP, especially with the requirements that were in our original RFP, and HART at the time, it did not meet a lot of those requirements. I had substantial discussions with the state's attorney's office. And I remember right before the finance meeting last time, I got a call at 7:30 in the morning from Bob Berlin telling me they're going to pull the thing off of our agenda because of the RFP and some concerns. And then 10 minutes later, before the finance, I got another call from Bob saying that, at 2 in the morning, Adam found some pricing documents that our procurement office officer, who was no longer here, had done. And then we got the new scoring that was there. So I did have a lot of concerns with RFP. I'm glad staff went out. I'm glad the state's attorney, Bob Berlin, and his staff helped guide us through the process. And as we saw, we have a non-responsive bid in Dominion, which is similar to, I think, what we had last time. So I'm very confident in the RFP process and everything is fine there. My only other concern was regarding the certification. And at the time, HART had a 1-year extension with the state of Illinois on their equipment for 3.1, and they were supposed to go in for new testing. And Member Chaplin and I were on that conference call. They said they blocked out November for them to go in and get tested and recertified. We did get an email. I got an email last week saying that they were a little slow in getting it in front of them, the state board. So Unison is in front of them, but they're going to be testing their equipment at the end of November and December. So that should be, hopefully a test goes through. But what they're testing is 2.6. Believe it or not, 2.6 is a higher version than 3.1, which is what we were talking about in September. So they're not even bringing back the 3.1 that we were discussing in September. They're testing now version 2.6, which supposedly has some more bells and whistles, but that's different than what we were discussing back in September. So this is 2.6, which I think, I'm not sure what it has, but I had some conversations with Adam, but it's supposedly better than whatever 3.1 was. So 3.1 is not even going in front of the state for testing. They're going to be in November, December with I guess, upgraded from what we were looking at in September. The issue I had is just if they don't get recertified, I wanted to make sure we got our outlay money back. I talked at length yesterday with staff, and we have a payment performance bond requirement that they're going to have in there. So if for some reason they don't get certified, we can't use the equipment, we'll have a bond to protect us to be able to go out and get equipment that will work. So I'm now, I think, happy, although I'd like to see what 2.6 is. It's the new version, but thank you.
Thank you, Member Krajewski. Member DeCiani.
Thank you, Chairman. There was never a time where all of us, in my opinion, we're willing to step up and pay for election equipment. We just want to make sure we got a fair price and we got election equipment that would get us to the next decade. And my concern with going out to bid the second time, and the reason why I believe we didn't get a whole lot of responses, is because of a clause that was called ballot uniformity, which I think prohibits some of the other vendors from bidding because they didn't have that particular ability. And my concern, I'm glad we got the number down, the price is down, which is good, and I am going to support this. But my question is, given the challenges that we've had, and we've got court cases going on both in Cook and DuPage County, is there a way to differentiate the vote by mail ballot with the system? In case we have a recount, a discovery. Again, we've got multiple state and federal lawsuits going on currently with campaigns from this last cycle that I think is important. We have a campaign in Cook County where the former HR director is being sued, won a judgeship when she lost an election by 10,000 votes. And that is in state and federal court. So vote by mail ballots are a big question in that race, as well as election ballots. So my question is there a way to differentiate these ballots? Are they barcoded? Is there any type of a difference that we can look at in case we have an audit or a discovery? We know exactly where these came from.
We absolutely will know where they came from. And it's just a matter of how they are sorted and organized. We know, and we will continue to know with this system.
Is it, how is it differentiated, Madam Clerk? Is there a barcode? Is there a number on it, or what? How would you know?
They will just be kept in separate boxes, containers. They'll be sealed and signed off by election judges. And there will be a form. It's all filled out. That's put onto that box, and we'll know exactly where those ballots came from.
But if there was a movement from one box to another, we have no way of telling. No way of telling exactly where those ballots. I mean, I have a case in Cook County right now that I'm involved with actively, where a considerable amount of extra ballots came in, and we're trying to determine exactly where those ballots are at. If they're vote by mail or if they're election day ballots. But again, if they're differentiatable, you can see them, it's clear as day. If they're just in different boxes, it's kind of hard to sort those and actually see the difference. So I'm just asking that question just because I'm actively involved in the case.
Well, the only way they could be moved would be if election judges, teams of election judges move them. And I don't see that happening. Everything is sealed. Everything is signed off by election judges.
Right, very good. Again, I'll support this. I just have my reservations on the ballot uniformity issue. I would like to see a different distinguished ballot so that we know for sure which ones are vote by mail, which ones are election day, et cetera. I think that would be a lot more clear. And those other entities that did not bid the second time would have given us that option. So, but I will support this. It's on you. It's the first actually Hart County operated election system and we'll be using in the state of Illinois. So it's again, I'll support this, but it's going to be on you to make sure this is right and we don't have issues, and if there are challenges that we make sure we get a nice clear view as to what's happening.
And one more thing, Member DeCiani, the mail ballots will have creases in them with folds, so that will tell us also that was sent in the mail.
I get it, but it's easy to fold the ballot. That makes sense?
Well,
I mean, it's not rocket scientists that we're talking here. Again, there's multiple active cases. Some can go criminal the way it's looking. The HR director of the clerk's office is now a judge and lost on election night by 10,000 votes. That doesn't sound questionable. So never tried a case in our life and we got extra ballots that we're trying to figure out. So it's interesting. And again, these are active cases, both in state and federal court. So it's something that's important that we may have to make sure our elections have integrity and are 100% ethical. We can't have issues like this. Thank you.
Thank you. Thank you. Member Hart.
Thank you, Madam Chair. One of the most important things we do on this board, I believe, is invest in the security and safety and ease of use of our election system. And I'm really excited about this proposal that's put before us today. I know it took a little bit longer for some of us to get here than some may have liked, but I think ultimately what we have here today is a good deal for the taxpayer at almost $3 million less than the original price tag proposed. So I look forward to supporting it and appreciate all the work on all sides that went into making this a reality. I did have one quick logistical question. I know there's pending legislation in Springfield for the veto session that may enable counties to shrink the size or the number of precincts, if I have that correctly. If for some reason we don't need all of the machines that we're purchasing in this proposal right now today, do we have flexibility to reduce that? I don't know if that goes to the clerk or the state's attorney, but that's one thing I was curious about.
Yes.
Easy enough. Easy enough. All right.
Those are the kind of answers we like here. Thank you very much.
Great. Well,
All right, great.
Thank you again.
Any other discussion on this item? Okay, seeing none, all those in favor? Opposed, the motion carries. Thank you, Madam Clerk and our Deputy Clerk. Okay, thank you. With that, we move on to item C, Health and Human Services, Member Renahan.
Thank you, Madam Chair. I move to combine Health and Human Services items 9C, 1, 2, 3, and 4. These are all rental assistance related.
The motion by Member Renahan, a second by Member DeCiani to combine items under Health and Human Services, items 1, 2, 3, and 4. Continue, please. Or all in favor?
Aye.
Any opposed? Okay, the motion carries. Go ahead, Member
Thank you. I
Renahan.
move to approve HHSR 46821. This is a resolution appropriation to U.S. Treasury Emergency Rental Assistance Program, $10,672,016. HHSR 46921, authorizing those funds, $10,672,016 to transfer funds from general government to U.S. Treasury Emergency Rental Assistance Fund. HHSR 47121, resolution to create and transfer funds for general government to U.S. Treasury Emergency Rental Assistance Fund, $27,357,321. And HHSR 47221, resolution appropriation for the U.S. Treasury Emergency Rental Assistance Program in the amount of $27,357,321.
Okay, we have a motion by Member Renahan, a second by Member Schwarzy to approve items 1, 2, 3, and 4 under the Health and Human Service. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Okay, go ahead, Member Renahan.
Thank you. I move approval of change order HHSP 318A-21, amendment to resolution HHSP 31821 for DuPage Federation Human Services Reform for American Sign Language Services, increasing the amount by $8,050.
Okay, we have a motion by Member Renahan, a second by Member Desart. Any discussion? Okay, all those in favor?
Aye.
Opposed? Okay, the motion carries. Thank you for that report. We move on to Judicial Public Safety, and we have Member Renahan.
All right, thank you, Madam Chair. I move to combine JPS items 9D, 1, 2, and 3. These are all legal research materials contracts.
We have a motion by Member Renahan, a second by Member Desart to combine items 1, 2, and 3 under JPS. Any discussion? All those in favor?
Aye.
Any opposed? Okay, that motion carries. Please proceed.
All right, thank you. I move to approve JPSP 39321, contract to West to purchase legal books and updates for judiciary and staff for legal research, December 1st, 2021 through November 30th, 2026, $510,853. JPSP 39221, also with West to provide patrons online research passwords for the law library, November 1st, 2021 through November 30th, 2026, not to exceed $354,177.72. And JPSP 39121, also with West to provide staff online research passwords for the law library, November 1st, 2021 through November 30th, 2026, not to exceed $151,678.80.
Okay, we have a motion by Member Renahan, a second by Member Desart to approve items 1, 2, and 3 under JPS. Any discussion? Okay, all those in favor?
Aye.
Opposed? Okay, the motion carries. Thank you, Member Renahan. We move on to Public Works, Member Ozog.
Thank you, Madam Chairman. I move for approval of PWP 039521, recommendation for the approval of a contract to LAI Limited for the purchase of Zurich valves and replacement parts for the Woodridge, Knollwood, Nordic wastewater treatment facilities for a 4-year period, October 27, 2021 through October 26, 2025 for Public Works. Contract total amount not to exceed $80,000 per competitive bids, not suitable for competitive bids, sole source.
We have a motion by Member Ozog, a second by Member DeCiani. Any discussion? Okay, all those in favor?
Aye.
Opposed? That motion carries. Member Ozog.
Thank you, Madam Chairman. I move for approval of PWP 039621, recommendation for the approval of a contract to Superior Industrial Equipment LLC for rehabilitation of Nitro pump number 1 at the Woodridge Green Valley Treatment Plant for the period October 27th, 2021 through November 30th, 2022, for a contract total amount not to exceed $50,000, not suitable for competitive bids, sole source.
Okay, we had a motion by Member Ozog. I heard a second by Member DeCiani. Okay, discussion. All those in favor?
Aye.
Opposed? Okay, the motion carries. Thank you, Member Ozog.
Thank you.
We move on to technology. Member Selman.
Thank you, Madam Chair. I move on TEP 397-21, a recommendation for the approval of a contract purchase order to Infor Inc. for our ERP system maintenance and support. This contract is from November 13th, 2021 through November 12th, 2022 for a total of $198,602.35 in sole source.
Okay, we have a motion by member Selman, a second by member Chavez or Covert, member Covert. Okay, any discussion? All those in favor? Opposed? Okay, the motion carries. Thank you, member Selman. We move on to finance resolutions. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0460-21. It's a resolution acceptance of the extension of the Giving DuPage staff grant.
We have a motion by member Krajewski, a second by member Desart. Any discussion? Okay, seeing none. All those in favor? Opposed? Okay, the motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0459-21. So the resolution acceptance and appropriation of the HUD 2020.
We have a
Grant.
motion. We have a motion by member Krajewski, a second by member Chavez. Any discussion? Okay, all those in favor?
Aye.
Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0474-21, resolution renewal of group insurance program.
We have a motion by member Krajewski, a second by member Garcia. Any discussion? Okay, seeing none. All those in favor?
Aye.
Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0479-21, resolution authorization to transfer and appropriate $927,440 in additional funds from the general fund to the county infrastructure fund.
We have a motion by member Krajewski, a second by member Garcia. Any discussion? Okay, all those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0495-21, resolution placing names on payroll.
We have a motion by member Krajewski, a second by member Salmon. Any discussion? Okay, seeing none. All those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0496-21, resolution additional appropriation for the general fund, $5,873,891.
We have a motion by member Krajewski, a second by member Desart. Any discussion? Okay, seeing none. All those in favor?
Aye.
Opposed? Okay, that motion carries. Member Krajewski.
Thank you, Madam Chair. And last, I move on FIR 0497-21, resolutions First Amendment to the Emergency Rental Assistance Program Intergovernmental Agreement.
We have a motion by member Krajewski, a second by member Chavez, and I'm member Pachowski.
Are we doing something different now? It seems to me to make sense. I don't know what we've done in the past, but just, I'm just curious if this is what we've done in the past, or is this something different in giving them the right to reallocate unused fees?
Anybody? Oh, Mary Catherine, come up. Okay, we have Mary Catherine from Finance.
We explicitly stated the amount in the agreement, the MOU between us and them. And so because of that, they actually, their administrative rate has been lower. So they want to spend that on benefits. So this is just a minor change to that agreement, but it's in the best interest of the county because, you know, there are going to be more people that get rental assistance benefits.
All this does is give them the discretion to do it. It says shall have the right. But have we done something different otherwise when we had used portions of fees in the past? Was there something different that was done, or was this the same thing?
It was really a one-time agreement that we did with IDA with this new money that we got for ERA 1. So the way we had it spelled out in the contract before was explicit. They were to get, you know, X percentage for the administrative rate.
All right, good.
So,
thank you very much.
Okay, member Tornatori, did you have a question?
No, Madam Chair, I just wanted to also, as a member of the IDA board, I can assure you that the reason that IDA is doing this is because it was more efficient for them to be able to handle this than for us to reinvent the wheel. And I have been assured from both the IDA staff and the executive director that any additional monies that may be left over will be allocated to DuPage County if at all possible. So we're always going to be at the top of the list.
Great, thank you so much. Any further comments or any other discussion? Okay, seeing none, all those in favor?
Aye.
Opposed? Okay, the motion carries. Thank you, member Krajewski. And now we move on to 2022 budget resolutions and ordinances. Member Krajewski.
Thank you, Madam Chair. Move on FIO 0100-21, ordinance DuPage County 2021 tax levies for fiscal year 2022.
We We have a motion by member Krajewski and a second by member Garcia. Any discussion? Okay, all those in favor? Opposed? That
No. Krajewski.
Oh, Krajewski's, okay, Krajewski voting no. That motion carries. Can we combine any of this? Yes, he would, did you? Okay, sorry. Okay, yes. Thank you, Connor. Okay, member Krajewski, please.
Thank you,
Proceed.
Madam Chair, and I was going to read them separately anyways, Connor. Move on FIO 0101-21 County of DuPage Century Hill Lighting Fund 2021 tax levy fiscal year 2022.
We have a motion by member Krajewski, a second by member Zay. Any discussion? Okay, seeing none. All those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski.
Thank you, Madam Chair. Move on FIO 0102-21, which is the annual appropriation ordinance for the County of DuPage, State of Illinois for the fiscal period December 1 through November 30th, 2022.
Okay, we have a motion by member Krajewski and a second by member Zay. I am advised that with regards to this ordinance, the schedule of appropriation needs to be amended to reflect the addition of $927,440 for the security cameras. And we have $2.5 million that need to be added to this for capital infrastructure improvements. So can I have a motion to amend this
I'll make a
ordinance?
move. Second.
Okay, we have a motion to amend by member Krajewski and a second by member Garcia. Any discussion on, or all those in favor?
Aye.
Opposed? Okay, any discussion on the amendment? Okay, seeing none. All those in favor?
Aye.
Opposed? Okay, the motion carries. Thank you. Member Krajewski?
Thank you, Madam Chair. I move on FIO 0103-21 annual appropriation ordinance for police records management systems.
Oh, excuse me, member Krajewski, hold on. We have to go back to the original motion too for the
We did it. We voted twice.
We did,
voted
okay.
on the
Oh,
amendment.
Connor
and then
just,
we-
sorry, Connor
yeah,
told me that.
you were
Okay,
sleeping at the wheel.
thank you, Connor. I thought we did, but Connor told me we had to go back. Okay, thank you. Please proceed.
So I just made a motion on the police records management.
Okay, so we have a motion and a motion by member Krajewski, a second by member Garcia. Any discussion? All those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0481-21 authorization to transfer funds to the taxable general obligation bond series 2010A and 2010B debt service fund.
Okay, we have a motion by member Krajewski, a second by member Krajewski. Any discussion? Seeing none, all those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0482-21 abatement of the 2021 tax levy for the general obligation refunding bonds, series 211.
We have a motion by member Krajewski, a second by member Zay. Any discussion? All those in favor? Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. You got that one, Dana, right? I didn't do both, right? I move on FIR 0483-21 resolution abatement of the 2021 tax levy for general obligation refunding bond series 2015B.
We have a motion by member Krajewski, a second by member Zay. Any discussion? Okay, all those in favor?
Aye.
Opposed? Motion carries. Thank you. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0484-21 resolution abatement of the 2021 tax levy for the limited tax general obligation refunding bonds for the court project series 2016.
We have a motion by member Krajewski, a second by member Zay. Any discussion? Okay, all those in favor? Opposed? The motion carries. Member Krajewski.
I move on FIR 0485-20 and resolution authorizing to transfer funds to the general obligation refunding bonds, the alternative revenue source for the stormwater project series 2016.
Okay, we have a
Debt
motion by
service
member
fund.
Krajewski, a second by member Garcia. Any discussion? Okay, all those in favor? Opposed? The motion carries. Member Krajewski.
Thank you, Madam Chair. I move on FIR 0486-21 resolution appropriation for the general obligation debt certificates series 2017 debt service fund.
Okay, we have a motion by member Krajewski, a second by member Ozag. Any discussion? All those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0487-20 on resolution for appropriation for the general obligation limited tax certificates for indebtedness series 2019.
I have a motion by member Krajewski, a second by, who was that? By member Zay. Any discussion?
Just
All
real
those in
quick,
favor?
Just
Oh.
real quick, I'd say, I mean, we talked about this a long time ago, but we were going to be looking, Jeff, at all those bonds that we have out there and possibly, you still looking at that? We had all the interest that we were paying on all these bonds that we were looking at maybe getting rid of a couple.
And we could still look at that. We have a little bit of time left in the fiscal year.
I don't need to do it this year, but I mean, you were looking at, I mean, that was something we're going to be looking at going forward. Retiring some of those.
To retire some of these?
Correct.
We were talking about retiring them if we had enough surplus this year.
We
So,
do
I
have
mean, we can
surplus.
continue to look at that.
I was hoping you are.
Yeah.
Okay.
Oh, yeah, we talked about that internally.
Okay, I just want to make sure you guys are still looking.
Yeah.
Thank you.
Okay, any other discussion? All those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0488-21 appropriation for the special service area number 35.
We have a motion by member Krajewski, a second by member Zay. Any discussion? All those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0489-21 appropriation for special service area number 37.
We have a motion by member Krajewski, a second by member Zay. Any discussion? Okay, all those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0490-21 authorization to transfer funds from the general fund to the tort liability fund for fiscal 2022.
We have a motion by member Krajewski, a second by member Garcia. Any discussion? All those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0491-21 authorization to transfer funds from the general fund to the DuPage Care Center Fund for fiscal 2022.
We have a motion by member Krajewski, a second by member DeCiani. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0492-21 resolution authorization to transfer funds from the general fund to the stormwater management fund for fiscal year 2022.
We have a motion by member Krajewski, a second by member Garcia. Any discussion? Okay, all those in favor?
Aye.
Opposed? The motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0493-21 resolution approval of the fiscal year 2022 head count.
We have a motion by member Krajewski, a second by member Chavez. Any discussion? All those in favor?
Aye.
Opposed? Motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIR 0494-21 resolution compensation structure wage adjustment guidelines.
We have a motion by member Krajewski, a second by member Garcia. Any discussion? Okay, all those in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIO 0104-21 ordinance 2021 tax levies for the Board of Health Operations, Board of Health Municipal Retirement, and Board of Health Social Security. For
We
fiscal
have a
year
motion by
2022.
member Krajewski, a second by member Desart. Any discussion? All those in favor?
Aye.
Okay, any opposed? The motion carries. Member Krajewski?
Thanks, Madam Chair. I move on FIO 0105-21 ordinance for the annual appropriation ordinance for the Board of Health Operations, Board of Health Municipal Retirement, and Board of Health Social Security Fund.
We have a motion by member Krajewski, a second by member Garcia. Any discussion? All in favor?
Aye.
Opposed? Okay, the motion carries. Member Krajewski?
Thank you, Madam Chair. I move on FIO 0106-21 ordinance, the annual appropriation ordinance for the Emergency Telephone System Board of the County of DuPage for the period ending 2022 November 30th.
I have a motion by member Krajewski, a second by member Schwarzy. Any discussion? Okay, seeing none. All those in favor?
Aye.
Opposed? The motion carries. And member Krajewski?
Yeah, thank you, Madam Chair. Last, I move on the approval of the fiscal year 2022 financial plan.
We have a motion by member Krajewski, a second by member Desart. Any discussion? Oh, I'm sorry, member LaPlante. Any discussion? All those in favor?
Aye.
Opposed? The motion carries. We move on to item 11, informational, member Krajewski.
12 here, but I will move on.
Oh, 12, I'm sorry. Yeah, 12.
Receiving and placing on file informational items, A, payment of claims, B, wire transfers, C, appointments, and D, grant proposal notifications.
We have a motion by member Krajewski and a second by member Garcia. Any discussion on these? Okay, seeing none, all in favor?
Aye.
Opposed? Okay, the motion carries to receive and place on file. And any old business? Member Desart.
Thank you, Madam Chairwoman. I would just like to understand between now and county board, I'd like to go back to 11.3. What happened between Friday and today that we had to add the $927,000 of cameras and $2 million in the capital infrastructure? I know, I don't bring my computer, so I can't look it up myself, but I know it started on page 196, this particular ordinance. And maybe Nick or
Yeah.
Jeff, why the last minute additions of the cameras and the capital infrastructure on the floor?
Yep, they can, I think they can answer that right now. Yeah.
And if you can't answer, just anytime between now and sound board would be great.
How much we want to answer, because if you remember, this was related to executive session.
I understand.
Everything that was given the approval in executive session is funded within this transfer.
Gotcha. I understand. So why couldn't it have been in the packet? As, I don't know.
It's, and if you remember, it's simply infrastructure within, so it's being put in infrastructure for security improvements.
Okay, thank you.
Thank you. And any new business? Okay, seeing none, I am advised that we have executive session. I will read the motion to go into executive session, but as we head into executive session, we ask that people who are logged in via Zoom, please disconnect, and those physically in the room, we ask that you leave the boardroom until we rise out of executive session, at which time we will welcome everybody back. So pursuant to the Open Meetings Act 5 ILSC 120/2 C21, review of executive session minutes. Can I have a motion? Can I have a motion? Second, moved by member Desart, second by member DeCiani to go into executive session. We did this by all in favor? Opposed? Okay, we will head into executive session. Okay. Okay, we are rising out of executive session back into our regular board meeting. Could we please take a roll call?
Member Chaplin,
Here.
Member Chavez, Member Covert, Member Desart, Member DeCiani, Member Eckhoff, Member Garcia, Member Hart, Member Krajewski, Member LaPlante, Member Ozog, Member Pachowski, Member Renningham, Member Rutledge, Member Schwarzy, Member Selman, Member Tornatori, Member Zay.
Okay, we have a quorum. Thank you, everyone. So I will, can we have a motion on matters referred from executive session on FIR 047421 resolution review of finance executive session minutes? It's in the resolution. So we have, I'm sorry, we moved by member DeCiani, seconded by member Zay. Any discussion? All those in favor? Opposed? The motion carries. Can I have a motion to adjourn? A motion by member Desart, a second by member Selman. All those in favor? Opposed? The motion carries. See you all in 2 weeks. Thank you.